We all grew up watching zombie movies on television. Seeing people eat each other's brains out used to be our favorite evening entertainment. But what if I tell you that the lines between real life and fiction have just blurred? Yes, a new flesh eating virus or zombie virus is taking hold of the population of Japan rapidly. This rare bacterial infection that has a very high fatality rate is spreading across Japan. Streptococcal toxic shock syndrome, commonly known as the flesh eating bacterial disease, has seen a sharp spike ever since Japan lifted the coronavirus travel restrictions. The official data published by Japan's National Institute of Infectious Diseases shows that this year the country has seen nearly 1,000 such cases till June. This is a dangerous increase in numbers as compared to the last year. Meanwhile, a South China Morning Post report says that authorities in Hong Kong have issued advisory to those people traveling to Japan to take the strictest precautions. Now, having dealt with a global pandemic already, you would think, oh, what's the big deal? We got through one, we'll get through another, right? Wrong. According to a professor in infectious diseases at Tokyo Women's Medical University, patients infected with this virus have died as soon as 48 hours from contacting the virus. This virus is characterized by the rapid onset of shock and multi-organ failure, which can be life-threatening if not promptly treated. Initial symptoms of STSS include fever, chills, muscle aches, and nausea. As the disease progresses, more severe symptoms such as low blood pressure, rapid heart rate, and even organ failure can occur. The treatment of this bacteria involves high-dose antibiotics and supportive care, which are required immediately to prevent life-threatening results. People with an open wound are at increased risk of STSs. This includes individuals who have recently had surgery or a viral infection that causes open sores. However, experts haven't been able to figure out how the bacteria enters the body for nearly half of the people who get diagnosed. According to a Bloomberg report, a person infected with this horrible disease may suffer a very, very painful death within 48 hours. People have been asked to maintain high standards of personal hygiene and make sure to watch out for any fresh wound. As per Bloomberg, the common symptoms of this rare flesh-eating bacteria include sore throat and marked swelling in the throat region. However, at times, doctors have also discovered a sharp deterioration of sore throat condition into fever, low blood pressure, organ failure, and ultimately death. STSs it may be preceded by fever and chills with nausea and vomiting, as well as non-specific symptoms such as headache or symptoms of a sore throat or painful swallowing, which then progresses to sepsis and organ dysfunction. Risk factors include subabsorbent tampon use, nasal packing, post-operative wound infections, recent influenza infection, as well as compromised immunological state. In the late 2022, multiple European countries reported an increase in cases of invasive diseases, including streptococcal toxic shock syndrome, to the World Health Organization. According to a Bloomberg report, this surge followed the relaxation of COVID restrictions in all these countries. Doctors have said that with global traveling on the rise, it is very important to maintain good personal hygiene. Any case of sudden fever or pain should be taken very seriously. Fresh wounds, cuts, or minor injuries should be cleaned properly. Pandemic precautions such as washing hands regularly, maintaining social distance, and making sure to be clean and cover wounds and cuts should be followed. Now the question is, whether or not such a virus will trigger some kind of global pandemic or even worse, a zombie apocalypse. Who knows for sure? But one thing that you can be sure of is of finding interesting and up-to-date content right here on this channel. So don't forget to subscribe to our channel and smash that like button.